There's just no way that those activists back in those 1970s could have possibly conceived what Asian Health Services has grown into today.
We were young, rather idealistic.
I would say none of us thought that we would be around 40 years later.
I grew up here, born and raised in Oakland, and Chinatown was always small. And my mother was a garment factory worker. Because it's cheap labor, there was actually no benefits, no health care. At that point in time, most of the other ethnic groups, the minorities, got a lot of inspiration from the African Americans.
Black is beautiful! Greenwood! Said I want to free! Greenwood!
In the early 70s and in the late 60s, the spirit of the Panther, we could say, that spirit permeated everything in Oakland. Oakland was certainly a place where everyone was engaged in some sort of political, social activity toward creating a different and better world. Let's make something happen. Let's get something changed. Let's do it ourselves. The Bay Area was really alive with plenty of young people, particularly.
And a lot of the Asian Americans also participated in the civil rights movement, the movement against the war in Vietnam. There was also a movement to return to the community. Locally here in Oakland, there was what was called EPICA. In 1973, they formed a health project that did a health fair and a survey looking into the needs of Chinatown, which at this point was mostly Chinese. And the turnout was spectacular, highlighting the desire of this community for more information and telling us what their needs were. And because of the success of the health fair, a subsequent group got together, other people from this community, not just students anymore, started to draw up bylaws, seek funding, and eventually formed Asian Health Services. I think we were incorporated in 1974, 40 years ago. The County Board of Supervisors granted us a small grant. We had enough money to hire two of us. Karen Morey, she and I became the staff people here at Asian Health Services. Karen ran the office. I was the director, looking at ways to form a clinic, starting from scratch.
When I first came to Asian Health Services, it was in the late fall of 1974. The clinic was on 10th and Harrison, right on the corner, on the second floor above the Episcopal Church.
To me, that was a big place. But of course, when I say big place, in comparison, it was about 200 to 300 square feet tiny room, but we housed a lot of people.
We actually wanted the spot that had a sink, because that's required in providing a clinic. And at that point, Henry and Connie Chang had their business there. But they were so gracious that they moved across the hallway.
There was a lot of prep work, which none of us had actually done before, but there was a lot of energy, and the vision was that, oh, okay, we're going to do something for this community who has been underserved.
This is an examining room at Asian Health Services here in Oakland. Since 1973, the people here have been providing health care for the Asian community of Alameda County. The belief is that all people have a right to quality health care, regardless of income, regardless of their ability to speak English.
There is a limited number of opportunities for our patients to go to see a practitioner, a provider that shares the same cultural background, that looks the same, that speaks the same language, and the economics will prevent a lot of people from taking the initiative to seek services, primarily because they don't have any insurance. When you don't have any insurance, you have to pay out of pocket. If you have to pay out of pocket, it's got to be bothering you pretty bad before you are willing to go see a doctor. When you put these two factors together, the financial factor and the cultural factor, it just limits people's options. Healthcare is an issue that should be a right.
And when I think of Asian Health Services, three things come to mind, and they're each critical. And the first obvious one is patient care. I mean, how many hundreds and thousands of families and patients have received quality care that they might not have gotten anywhere else through Asian Health Services over the years. The second benefit is the issue of advocacy and movement building. Not just advocating for services for the patients in its community, but for all underserved populations of any ethnicity, of any race, of any gender, of any sexual orientation across the state of California and even in Washington. And then the third is the really extraordinary track record of leadership.
Probably our most prized staff person has been our executive director, Sherry Hirota.
Well, Sherry came to the organization in 1976 as an administrative assistant. She had previously been a patient of the clinic along with her son, Jackson. Her leadership was immediately apparent. She had worked as an activist in so many different settings that she could bring that experience and that vision of what the community's needs were and what they could accomplish.
Your priority is just jail and guns. If you don't see that services are necessary, then your priorities are upside down. We cannot wait 30 days when our kids are sick. We cannot wait 30 days when we need food stamps and our kids have no food to eat. We cannot wait 30 days for all these things. People's lives are at stake. We are drawing the line somewhere. You've been doing this all damn year long.
She is a gladiator of Asian Health Services. So any time when we need a battle, we always have Sherry to fight for us.
The essence of what clinics evolved around, healthcare to the poor, healthcare to communities who had no access because of language, because they were undocumented workers.
I remember one time Sherry and I talked about how to demonstrate the need for interpreters at Highland Hospital. Because the reaction there was that, why should we hire interpreters? Show us the need. Well, Sherry organized a press conference at Highland Hospital. And the conference included many non-English speaking Asian patients who said, we need health care, but we can't come here because you don't speak our language.
Is the county able to handle our needs? We found that that was not so. We found that there were not enough bilingual staff at Highland Hospital. They were asking us to translate. Okay, we found that most of the social services are not available.
Sherry was instrumental in leading us to pushing the county to hire interpreters. Now the county has one of the best interpreting services.
So certainly Sherry has been a role model to so many of us and just a tremendous leader, but I think she has really spawned other leaders and supported other leaders.
When you think of people like an Art Chen, a Winston Wong, a Kathy Koh, a Tessie Guillermo, and so many others. Many of them have been on the board of the California Endowment and have infused our values.
I think Sherry has something to do with that, with her mentoring, with her support. I think certainly by being a role model that we have seen tremendous leaders come out of that clinic.
We have in Sherry someone who's lived through a lot of the earlier days and continues to recognize the importance of working closely with our communities and taking direction from our communities and involving them in leading their own struggles.
Hi. Hi. Chào chị đi khỏe không? Dạ, chị em khỏe. Ok. Gặp lại cái thấy mừng rồi, đúng không? Xong mùng 5 tháng 10. Yeah. Okay.
Being part of Asian health and thinking more globally about a patient's health is what you do not only as a primary care doctor but as a patient advocate. I live and work right in the same communities that my patients and my staff live and work. And so we face the same injustices and the same economic and social hurdles and barriers. And for me, I feel that it's really important to engage them and to fight for equalities that everyone deserves. So we started from a small clinic and now to a large organization to over 350 employees that serves over 24,000 patients and serving over 11 different Asian languages. And not just only Asian languages, but we really are there for medically underserved patients from all over the world.
Our providers, many of them are actually first-generation immigrants themselves, and they have the language fluency. They've also come from top medical schools and training programs. They could work anywhere, but they've chosen to work here. And they've chosen to work here because they really believe that this is a way to give back to the community. We are 6 medical clinics and 2 dental clinics, plus a roving dental team that goes through the Oakland school system. It's an amazing coalition of people who are really super dedicated and clearly are true believers in our mission and really want to actually be part of making a healthy community.
Well, 40 years, Asian Health Services has withstood the test of time. And so I just have to say that the Asian Health Services has established a track record and has really been tested in many, many ways and has proven that it has the right model, that it's committed to providing quality healthcare services, and that community healthcare centers really are necessary and are essential, especially now in the era of the Affordable Care Act.
I'm part of the new generation of doctors, and I look at the icons like Sue Chan, who has been at the agency for 40 years, and the staff who grew up with Asian Health and continue to stay. And they are the icons and the mentors that we all look up to. And I'm very honored to be carrying this legacy forward.
1, 2, 3.
There's just no way that those activists back in those 1970s who were thinking about this little health project could have possibly conceived what Asian Health Services has grown into today. And so it's just a reminder for all of us, dream big and act with courage and act with passion, and good things will happen. And that little engine that could is now a fast-moving locomotive.
I'm so happy for work for Asian Health Services.